is stuck on the cheek. It is euphoric and relaxing. According to an article by Dr. Tijani Al-Mahi, in some African village, chewed cat leaves used to be thrown on an external genitalia to accelerate a difficult labor. Very funny. In his article, Indian Remedies for Poor Memory, PMJ, 1951, Sohrab A.E. Hakim said, from the same botanical family, example Cholesteraceae, comes the suggested Cata edulis fosc, a well-known and excellent African stimulant beverage called Bushman's tea, also containing alastrin, along with other alkaloids and having posondrine, caffeine, and amphetamine-like action, stimulating the central nervous system without subsequent secondary depression. In the same volume, 1951, of the BMJ, this article is answered by D.A. Baird, who says it is true that Cata edulis is a stimulant narcotic, and when in small quantities produces a sense of mental alertness, which in turn might have the effect of stimulating the memory process. The fact is, however, that it is a most dangerous drug of addiction, which in countries such as Southwest Arabia, Somaliland, Abyssinia, and parts of East Africa is known to have deleterious effects on the healthy and social conditions of those who indulge in it. Sohrab A.E. Hakim replied to this in BMJ 1952, still under the title Indian Remedies for Poor Memory. My mention of Cata edulis as an excellent stimulant beverage without subsequent depression in therapeutic doses was based on Watt and Breyer's branchogic references, and particularly on Markendall's Extra Pharmacopoeia, 1914, IP 325. When Cata is mentioned as a drug known for generations for its sustaining power and the therapeutic pre-narcotic dose, for its solid and liquid extracts are given. All beverages, including the caffeine containing tea and coffee, can be harmful in overdoses or during prolonged misuse. Amphetamine, which is a cortical stimulant, can produce addiction and other toxic effects, and yet is a very valuable drug in narcolepsy and depression states. Clinical manifestation of CAT. On cardiovascular system, tachycardia, palpitation, extrasystoles, hypertension, which might cause cerebral hemorrhage, ischemic heart, and infarction and pleurisy. 2. On the respiratory system, pleural effusion, hemorrhage, tachypnea, increased respiratory rate due to the central effect of CAT in the medulla oblongata, relaxation of the bronchi and trachea in combating fever or high temperature. Number 3, increase in body temperature with sweating. 4, mydriasis or white pupil. 5, deterioration of sexual potency, starting by increasing the libido, then with seminuria. 6, on gastrointestinal tract, stomatitis, gastritis, cirrhosis of the liver, constipation, paralytic alias, loss of appetite by its central effect on the hypothalamus. 7, psychological effect. It's a central stimulant producing feeling of happiness, euphoria, wakefulness, and well-being. It increases mental alertness, excitation, sensation of fear, and anxiety, insomnia and neurosis, insanity and schizophrenia symptoms. It differs according to the type of leaves, the origin of that leaves, and body constitution. At number 8, addition, the physiology of the system becomes completely CAT dependent according to WHO report. This plant is directly or indirectly involved in many of the Yemeni health and economic problems. Its anorexic effect encourages nutrition while it is not nutritive itself. The malnutrition leads to pellagra, anemia, peptic ulcer, TB, neurosis, and hepatomegaly. Fortunately, part of the Yemeni diet consists of hulba, made from lentils, green vegetable, and wheat soap, and rich in vitamins, especially A, B, C, and D, and in minerals, 27% essential type amino acid, 50% carbohydrate, also phosphorus compounds and calcium. Hulba is recommended for pregnant women and to stimulate lactation. All in all, it is a good scent to the caretaker, especially since its laxative properties counteract the constipating effect of cat. Besides the digestive harm done by cat, we must remember the threats to respiratory health posed by the sealed window and smoke, and also the risk of spreading TB, other infectious diseases, and skin infections via the communal mouthpiece of the hookah. D-norisoephedrine has a paralyzing effect on the brain, spinal cord, and peripheral nerve centers. Pepe states that an infusion of the leaf is pleasant to the taste and has been used in Africa in treating cough, asthma, and other chest diseases. Stowe mentions that the Bushmen use the shoot as a specially nourishing food. This reminds one of the use of coca in India in Indians. In Tanzania, the leaves and roots are used to cure influenza, and the roots are eaten to cure stomach pain. The wood is used in Tanzania to make spoons and comb, while the wood is said to be a very good food and is also used for building native huts in both Tanzania and Kenya. When I was reading a book, The Systemic Diseases, called Selected Topics on the Systemic Diseases, there was an article written by Dr. N. Frank, Robert N. Frank, MD, from the National Institute of Health, Bethesda, Maryland, Washington. He mentioned, or he wrote a topic on the diabetic retinopathy, in which he said, the only group yet studied in which the prevalence of retinopathy in the diabetic population is allegedly low are Yemenite Jew living in Israel. No such satisfactory explanation has been offered for this observation. That was in page 76 from the 1974 edition. So he went to Israel, he done research there, he wanted to make a survey on the diabetic retinopathy. So he found that the least affected people from the complication of the diabetes on the retina are those Yemeni Jews. And he was surprised and he couldn't have any explanation for that. So I have written to him a letter on the 11th, 7th, 1977, suggesting that cat might be the reason for that. And on the 10th, 1978, August, he replied, Dear Dr. El-gorafi, thank you very much for your letter about possible influences of the diet of people living in Yemen on diabetic retinopathy. Due to the slowness of the mail and the fact that my address was changed because he has moved to Detroit, Michigan, the basic medical science, Scott Hall. I have only today received your letter. It may very well be true that differences in the diet or of other habits of various groups of people may affect the probability that they will develop diabetic retinopathy. The chewing of cat leaves, as you suggest, may be important because of the potent pharmacological agent that they contain. It will require a great deal more work to understand the possible causes and means of prevention of diabetic retinopathy. But your idea is an interesting one that is well worth considering. Thank you very much for your thoughtful letter. Sincerely yours, Robert and Frank Midi. And later on, I have written to Dr. Bruce A. Spivey, MD, the Executive Vice President of the American Academy of Ophthalmology, about the same subject, suggesting that their laboratory might help a lot in discovering root material found in gut or present in gut, and it might help treating the complicated diabetic retinopathies, and it might be a remedy to cure these complications for good. He replied, "Thank you very much for your letter and enclosure. I find your comments interesting and appreciate the opportunity to review this issue." June 14th, 1984. Bruce E. Spivey, MD, Executive Vice President. When I was talking to one of my colleagues, American colleague in Rome this year, in the International Congress of Ophthalmology, he suggested that the only people who are interested in such a topic is the drug companies who make drugs. So if I can write to them, I'm planning to do that soon. Thank you. Next time, I'm going to talk about CONT as an international problem.